The liver is amazing. It is the largest solid organ in the body, occupying the right upper abdomen behind the rib cage. The liver performs over 500 different functions in the body, including making the proteins we need for clotting blood, filtering and detoxifying the blood, and producing bile, which helps us digest fat and vitamins. The liver can get injured over time for a variety of reasons, including alcohol and viruses. The liver can heal itself for a while, but eventually the damage can become permanent. This is called cirrhosis. Patients that develop cirrhosis may need a liver transplant. Living liver donation is one way that patients may be able to get a new liver. So how do we decide who can be a living liver donor? First, we must consider the health of the donor and the health of their liver. Potential donors will go through a series of blood tests and imaging scans to evaluate their health and the health of their liver. Potential donors will also meet with many members of the transplant team to talk about donation, the surgery, and the recovery. Second, we consider how much liver will the donor have left after surgery, and third, the amount of liver that the recipient will receive and how much they need. Anatomically, we think of the liver as having two sides, a right and left side. This is based on the blood flow to the liver and the blood flow for the liver back to the heart. Both the right and left can be used for donation, but we must consider the size of the donor's liver and the size of the recipient. In most people, the right side of the liver is usually about 60 to 70% of the total liver volume. Removing the right side of the liver for a transplant is most common. It gives the recipient enough liver volume for them to recover and thrive, while leaving behind at least 30% of the donor's liver, which is big enough for them to recuperate and do well. The operation for a liver donor requires an incision on the abdomen that for most people is the shape of a hockey stick. It starts from where the ribs join together and goes toward their belly button and then angles to the right side of the body under the rib cage. Next, we isolate the blood vessels that deliver blood to the right side of the liver and the big blood vessels called the hepatic vein that delivers blood from the liver back to the heart. Then, we cut through the liver carefully, dividing the blood vessels and bile ducts until only the big blood vessels to and from the right side of the liver remain. Finally, we remove the liver and flush it with a special solution to preserve the liver and keep it cool until it is ready to be placed into the recipient. When we think about the risks to the donor from this operation, it's important to remember how we performed the operation. Some of the risks are like those of any abdominal surgery, like bleeding, a wound infection, or a hernia, but some of them are specific to liver surgery. When we cut through the liver, we divide many small bile ducts and we run the risk of developing a bile leak. Most of these leaks will resolve with time. Some may require an intervention like an additional drain placement, and rarely, some may get infected, requiring antibiotics. After the operation is over, the donor will be monitored in the intensive care unit for about 24 hours. The donor will have IV or intravenous lines, and their blood pressure and heart rate are watched closely. Most donors will be up and out of bed later the same day. Their diet will be advanced, and they'll be encouraged to move around and work with physical therapy. Most donors will stay in the hospital for 5 to 7 days before being ready to go home. After they leave the hospital, donors will follow up with the transplant team in the clinic with regularly scheduled appointments. The donor can start to increase their activities at home and expect to take time off work to recover. One question we often get asked is, does my liver grow back? And remember how we said that the liver is amazing? Well, as the liver recovers from the donor operation, it starts to regenerate. That's not to say it's like a salamander who may lose its tail which grows back as it was before. Rather, if the donor's right liver is removed, they do not regrow a right liver. Instead, the left liver is stimulated to get bigger, eventually recovering around 90% of the total liver volume. The function of the liver will remain the same, and the liver is able to do all the jobs that it was doing before. This regeneration starts immediately, and the remaining liver grows to its maximal size in about 3 months. Just like the liver and all of its amazing functions and regenerative ability, people considering living liver donation are truly amazing too. Every donor should recognize the fact that they are life-saving heroes. We here at UCSD Transplant certainly do.